everyone. Welcome back. It is my great pleasure to introduce Dr. Pandurang Rotithar Ramchandra as our next speaker. He's going to speak on safe abdominal entry by round tip blunt trocar. Sir.
First of all, I would like to thank World Laparoscopic Hospital for giving me this opportunity. For last 2 days, we are going for all high-tech talks and all that. But for all that, you have to have first trocar entry. And till date, there is no safe method which is safe for 100% safe for doing first trocar entry. There are many methods which can which they are developed, and usually the surgeon is used to one type of the method to enter the abdomen. Second slide. So some go with the preparation of pneumoperitoneum first, or some put the direct trocar also. These are the most commonly used methods right now. And some use optic trocars also, which are open technique is also there, which most of the surgeons are used to it. With every technique there is plus point or minus point that we have to see. And this particular method, any method has got either omental vessel injury or bowel injury. So all these things can complicate the surgery. At the same time, failed entry is also a complication, and improper pneumoperitoneum or emphysematous supraperitoneal insufficiency can also happen. Blunt trocar is not used by most of the people because it needs lot of force, and there is chance of overshooting once you cover the resistance. To change this technique, we have had some modifications which has helped us to use this technique in complicated cases also. Multiple surgeries, pregnancy or big ovarian cysts, 36 weeks ovarian cysts. In such cases also there is problem in going into the abdomen. So, next. So these closed methods are commonly used, and of course Hasson's is also used by some. Okay, working. Hello. This one. So blunt trocar is not used because it needs lot of force. Then there is chance of overshooting. Though blunt trocars are used in ancillary ports once the pneumoperitoneum is created. In our technique, we are using towel clip to lift the abdomen, and this gives very good lift of the abdomen even in toned abdomen also. So which is sometimes very troublesome when one is lifting the abdomen with hand, or you need assistant also. In this method, we are having a surgeon who is giving the force and counter force. There is no need of getting any assistance from anybody. Only skin and rectus sheath is cut by blade. Rest of the things are separated as such. In laparotomy, we have seen that in Misgav, Ladakh, most of the times what we do only cut skin and rectus sheath, and all the layers are separated by finger. So this technique, this is the principle of this blunt trocar entry. Stopper is used to overcome the overshooting problem. The advantage of this is it is very quick and it can be used anywhere over the abdomen. For example, Hasson's is usually used in and around the umbilicus only. Another advantage of this is it can be used in big ovarian cysts also. So this is the blunt tip which we are using. It is absolutely round tip. It just cannot cause any trauma to it. We have modified one trocar also, where the smaller part is 5 mm, that again is with round tip, and again it gets tapered into big 10 mm size, and this gives the advantage that the force required for blunt trocar entry is reduced. This is not retractable tip. This is non-retractable tip. So this is how we are lifting. The surgeon is lifting with the non-dominant hand. The lift is so much, you can see the lift which we are getting in nulliparous patient also, and the trocar is going at right angles as usual. If you want, you can use this stopper, which is just simple stopper. You can adjust the length of the stopper as you want, and this will stop the overshooting of the blunt trocar once the resistance is over. This can be used in this type of big huge ovarian cysts also without puncture. Unfortunately, I cannot demonstrate the video here, though I have brought it. Some technical problem is there. You can see that the ovarian cyst is completely seen intact here. This is actually a video, but it is not possible to demonstrate you. So this is how we apply the lift. Actually, where we lift the abdomen, there only the clip is to be applied, so that it will give a good lift, and the entry of the this trocar in the same direction. You have to cut the rectus sheath so that our force will not be wasted. The advantage of this is, I am a professor, so giving any this particular blind technique to my student is always very difficult, and it gives me some fear also. But with this technique, it is easy to learn and teach also. So we are not afraid of whether the student will make any mistake or something. It is very quick. There is no CO2 leak at all. It can be done anywhere over the abdomen. And again, as I said, it is safe in big cysts also. It is time tested, done in more than 2000 cases now. Actually, this figure is also very small. We have done much more. The only disadvantage of this technique is there are these towel clip marks on the abdomen. So this is all my presentation. Thank you.
Thank you, Dr. Ramchandra. Obviously, entry into the abdomen has a lot of discussion and a lot of discussion in terms of technique and technology. Yeah. But entry through the Veress needle is well established, and in terms of safety, in terms of injury, and otherwise also. So, what advantage you have over the Veress needle entry? This your blunt trocar entry.
We don't need Veress needle to use in blunt trocar entry. We are doing it without pneumoperitoneum. There is no chance of injury. We have done at least more than 50.
After entering into the abdomen, you must be inflating with the CO2.
Pardon?
After entering into through the blunt trocar, you must be giving a CO2 inflation.
Yes. After checking that we are in, then only we are giving the pneumoperitoneum, not before that. We can put the laparoscope once we are sure that we are in. Then only we will be starting pneumoperitoneum.
So how many you have? Around 2,000 cases you have?
More than 2,000 now.
So you didn't find any problem?
No problem at all. Even in densely adherent tuberculosis patients also, big cyst patients also, and multiple surgery patients also.
Okay. Any question from the audience?
So I also have been using red blood trocar entry. I have done more than 800 cases. But whenever we apply the towel clip, we hold only skin, not all of the abdominal wall. That is the difference.
No, actually, sometimes what happens, if you have not completely gone in, then we have seen that with lifting the towel clip also, you can see that peritoneum moves along with that. Even if you have not punctured the peritoneum, you can see that peritoneum is also lifted. So this is actually our idea is that only skin is lifted is not actually correct.
Practically, I think only skin and some subcutaneous fat is lifted,
See, for blunt trocar, you need very good firm grip. That is very important. Without firm grip, if we are using like with hand, then it is not that easy to pass the trocar.
There is some special towel clip with rod.
This backhouse coil clip was with catch only. That is with catch.
For the past 15 years, I am using blood trocar, sir. This needle and the line using an after 2 times we are going blindly. Notice towards the blood trocar.
Sir, why blood trocar? Why not an open? Why not an open technique?
It takes more time. There is chance of leakage of gas. Here, there is no chance of leakage.
To lift the abdomen rather than the towel clip, I think the God has gifted us the umbilicus. So umbilicus God has given to us only for the laparoscopic surgeon. You put your thumb into it, hold the lower abdominal fold and lift it up. It is a very good technique. Try using that.
If there are scars over and around the umbilicus,
Then of course yes.
then Palmer's point we can use with the same method.
No, with the Palmer's point, if you are go through the optical trocar. Nothing like it. Very safe.
For
Under
optical
vision.
trocar again you have to have pneumoperitoneum now, which is again a technique with complications.
Just we are taking it to line.
Yeah. Okay. ठीक है.
So lot of things matter at the level of personal experience. So someone is comfortable with Veress, someone is comfortable with blunt trocar. So it is all it is not a matter of a lot of discussion. So thank you very much, Dr. Ramchandran. Our next speaker. Yeah.